Hi, my name is Mary. I am a diabetic nurse. Today's topic is about microvascular diseases and diabetes. Diabetes has become a social and economic burden internationally or globally. The World Health Organization reports 422 million people being diabetic, and over 99% of those cases are type 2 diabetes. Cardiovascular disease is the leading cause of death in diabetes. Diabetes is also associated with high risk of macrovascular diseases, which causes the damage to the large blood vessels. Patients with diabetes are at double the risk of developing heart diseases as compared to those who are not diabetic. There is a disease process called atherosclerosis. Atherosclerosis is a disease process causing narrowing of the blood vessels by atheroma or fatty plaques, which reduces the blood flow, allowing the blood clot to form or a plaque to rupture, causing a heart attack or a stroke. And it also causes the blood vessels to become harder and stiff, which increases the blood pressure as vessels are less elastic. Then that would lead to peripheral diseases, which increases the risk of amputation, causing the narrowing of the blood vessels to your legs or to your feet. There are three major microvascular complications in diabetes. This includes coronary artery diseases leading to heart attacks, stroke, and peripheral artery diseases. Diabetic patients are at risk of developing heart attacks or heart problems. It has been reported that they are 5 times at risk as compared to the non-diabetic individuals. Patients with diabetic neuropathy might not be able to identify signs and symptoms of heart attack, in particular those with autonomic neuropathy. Those signs include chest pain, chronic fatigue, intolerance to physical activity, and swollen ankles or legs. Brain vessels blockage caused by the clot or by the plaque may lead to the death of certain parts of the brain. And once that occurs, the brain won't be able to regenerate or grow back again. And this is called cerebral stroke. Or, as we know, we call it just a stroke. Diabetic patients are reported to be twice at risk of developing stroke or suffering stroke as compared to those with no diabetes. Most diabetic patients present with hypertension, or known as high blood pressure. This creates the pressure in the small vessels of the brain. Due to the blockage, then they will rupture, causing stroke. Now about peripheral artery diseases. Diabetic patients are prone to poor circulation, resulting from narrowing of the blood vessels, in particular on the feet and on the legs. Poor circulation will make healing process difficult or even slower. This could result in severe foot infection and could spread from the leg to the bone, and amputation may be necessary. Patients usually at first present with calf pain while walking, and at rest the pain eases off. Then you will notice hair loss on your legs and untreatable leg ulcers or ulcers that do not heal. Then at the later stage, there will be pain even at rest, or a bit of coolness in the lower extremities, or feeling cooler towards the toes. Macrovascular complications in diabetes may be preventable or even be managed. Keeping blood glucose levels between 4 and 7 millimoles per liter of 6%, blood pressure of 130 over 80, normal levels of cholesterol, and weight management. This is usually calculated or known as a BMI. The normal BMI would be 18.5 to 24.9. The waist circumference for men of 94 centimeters and for women of 80 centimeters. But these readings are different from the aging population. Lifestyle modification is also important in managing glycemic control or managing our diabetes. Regular and structured exercise, at least 120 hours per week of exercise. That will be effective. Avoiding sedentary life, eating a healthy and a balanced diet. Also, avoiding eating fast and processed